Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy beautiful NEET PG platform, and today's topic of choice is nothing but NEET PG last moment revision. As this March month is going on, it's our duty to keep revising and keep doing the amazing stuff as much as possible. So we have this rapid revision NEET PG session where I'm gonna ask you some important questions pertaining to milestones, pertaining to all in last 3 year question papers, right? So we're gonna start the class. If my voice is audible to everyone, please put a message in the comment section. Thank you. अगर मेरी आवाज़ आ रही है तो बताइए yes or no. Yes, I think my voice is audible. So this is a very beautiful platform of the NEET PG where we had this corner discussed some amazing important questions pertaining to the NEET PG exams. Okay, and if my voice is audible to everyone, please let me know. Thank you. My name is Dr. Anand Bhatia. I am MD Pediatrics and working as assistant professor. And yes, this is one of the beautiful platform. This NEET PG number one, we have this NEET PG free test calendar in the month of March. This is the second week. So we have the NEET PG free test calendar where most importantly we have this March 7th to March 12th amazing beautiful what you called a subject wise series of the free test. I hope you all guys have given this one. Okay, and yes, hello Priya, hi Julie, hi Shubhangi, क्या चल रहा है, व्हाट्सअप, कैसे हो आप? मैं आज ही वृंदावन से आया हूँ अभी 1 घंटा पहले और मुझे इतना हेडेक हो रहा है बहुत ज़्यादा. So in the Unacademy, we have something known as Plus subscription and something known as Iconic subscription. In the Plus subscription, you get all the amazing access to my live and recorded classes. You get to study from the best of the best educators all over in the India, and also you can study on your iOS, laptop, and any device. In the Iconic subscription, you get the Unacademy platform and the Prep Ladder subscription. All the recorded classes, competitive live tests, video lectures, everything you get. Also, congratulations to the amazing, beautiful toppers of FMG who have done such a good hard work. And now I want you all to be there on this platform. Yes, also if you're new to the Unacademy, please download Unacademy app where we have special class feature basically where amazingly we have some beautiful ways of making MCQs poll. You can ask me any doubt, you never miss the classes because all the lectures are recorded. Also, and yes, we have this NEET PG revision batch. I hope you all are guys are part of it. May 21st is coming. Time is really short. Let's give the best shot, right? So the batches we have for the FMG students, then we have a then I told you about the Plus and the Iconic subscription, and this is the month wise plan. All you have to use is the code if you want to buy the plan. This will be little financially comfortable for you if you use this code Dr. Anand. Let's start the amazing section. हाँ जी, जूली हाय. जूली सेज आपने रिप्लाई नहीं किया मुझे. अभी देखता हूँ मैसेज में, अभी देखता हूँ, मैंने रिप्लाई नहीं किया. ओके इब्जा, हाय सर, notification is not come sometimes. Okay, dear. I hope you all are part of our groups also, and I always put the links over there. Surbi, hello, sir. Anurag, I will also top this time. Definitely, Anurag. This is the confidence I want. You will. You were born to rock. That's it. That's it. Okay, Julie, मेरा बर्थडे विशेष का रिप्लाई नहीं किया आपने. आई रियली अपोलोजाइज फ्रॉम द बॉटम ऑफ माई हार्ट. मैंने नहीं देखा होगा मैसेज, इसलिए रिप्लाई नहीं किया. आई एम रियली सॉरी. एंड शुभांगी कौशिक, thank you so much for your wonderful gift. And my parents, they loved it. The whole scenario, the whole photos, collage, and beautifully you have written. When the gift came, I opened it, and in front of everyone, I loudly spoke every single line from top to bottom. क्या क्या लिखा है, एक एक शब्द को मैंने आराम आराम से पढ़ा और सबको सुनाया. और सब इतने खुश हुए, कहते ये कौन है. मैंने कहा शी इज वन ऑफ माय वेरी गुड फ्रेंड. दैट्स व्हाट. ठीक है, थैंक यू सो मच. लेट्स स्टार्ट द ब्यूटीफुल क्लास. Acha, now listen everyone. Now there's something important I have to tell you. Uh, okay. So this week actually, this whole week, I'm planning to start with. I have made some important PPTs on top 50s. Means number one, we have a video on top 50 triads in pediatrics. We have videos on top 50 images which can come for the exams. Top 50 criteria or classifications which you should know. Top 50 spotters that's important for exam. Top 50 x-rays for exam. So this is what I'm gonna do now from this week. Like next 10 days, we have the top 50s. The heading is top 50s. Part 1, part 2, part 3, part 4. Top 50s x-rays, top 50 triads, top 50s classification, top 50 images, top 50 one-liners, top 50 drug of choice. Are you understanding? These all are very important. Drug of choice, sodium valproate for absence seizures, phenobarbital for neonatal seizures. So these are very important. So ये हम करने वाले हैं. I hope you all guys are a part of it. Just stay in touch with me. me and you will like it. Okay, that's it. Hello, Prabhakar. Very sweet, very nice to see you. Let's start the class. So, yeah. So, before starting any amazing segment, we always have a motivating quote which says, "You are the artist of your own life. You are the artist of your own life. Don't hand the paintbrush to anyone else. You are responsible for yourself. You are responsible for your happiness. You are only responsible for your sadness also." No, no, no. I always keep happy. I am always a happy soul. But she made me unhappy. He made me angry. She made me angry. I don't get angry, but they made me angry. So stop giving that pravachan. No one can make you angry. You yourself, allow people to poke you or to get affected. So better be emotionally independent and don't let anyone hurt you physically, mentally, spiritually, and physically. Am I right or no, not? Yes or no? Yes, exactly. And Robin says this session will be useful for FMG also. Yes, buddy. Acha, Robin, this session definitely will be useful for FMG. And for FMGs, I have a special again 8:30 p.m. I have a class for FMGs also on the Unacademy app. I have a dedicated class today at 8:30 p.m. for the FMG students for the last moment FMG important questions. Okay, अगर टाइम लगे तो आज रात को 8:30 बजे आ जाना, ठीक है? And also remember that life is a one-time offer. Life is a one-time offer. Use it well. Use it really, really well. Okay, let's start the beautiful topic of this last moment questions, which are important and which are meaningful. Please read the question. Milestone in a 2-year-old child. Milestone in a 2-year-old child are, or I would say is or are. Even a single answer can be correct or multiple answers can be correct. What do you think, anyone? Milestones in a 2-year-old child is or are. What do you think? Ride a tricycle, weight increases by 4 times as birth weight. What do you think? A, B, C, D, Robin, Prabhakar, put your good vibes, every one of you. I don't know how long I will stay here. So it's better you put good vibes on this platform. Okay. So tell me, what do you think exactly? So milestone in a 2-year-old child is or are. So yes, number one, ride a tricycle. Can a baby ride a tricycle? Yes or no? Can a baby ride a tricycle? What do you think? A 2-year-old baby can ride a tricycle. When can a baby ride a tricycle? The answer is try. Try means 3, right? So a baby can ride a tricycle by 3 years, right, Priya? Very good, Priya. Yes. Okay, next one. Weight increases by 4 times of the birth weight. That what happened then? When does this happens? The answer is 2 years only. Okay, if you're a newcomer, let's learn little bit. What is the normal weight of a newborn? Anyone? What is a normal weight of a newborn? The answer is 2.5 to 4 kg. 2.5 to 4 kg is the normal weight of a newborn. When does the weight doubles? If a baby is 2.5 kg, when he will be 5 kgs, when will the weight doubles? Anyone? Yes, the weight doubles by, very importantly, 5 months. ठीक है, the weight doubles by 5 months from the birth weight, and weight triples by 1 year from the birth weight, and weight becomes 4 times by the end of 2 years. Are you understanding? That's fun. If a baby is 2.5 kg, after 5 months of life, he will be 5 kg. 2.5 से 5 हो गया. Weight doubles. So weight doubles by 5 months, triples by 1 year, 4 times by 2, triples by 1 year, and 4 times by 2 years, and 5 times by 3 years. Yes, you're right. Alternate steps in climbing stairs. Julie, what do you think, dear? When can a baby climb alternate steps in climbing stairs? Alternate steps. Anyone? 2 year, 3 year, 4 year. What do you think? When can a baby do climb alternate steps? So remember, a baby can climb alternate steps by 3 years. Very good, Shubhangi Kaushik. 3 years. 3 साल का बच्चा जो है वो सीढ़ियां चढ़ सकता है. अल्टरनेट स्टेप्स. 2 साल का बच्चा कैसे चढ़ेगा? हाउ विल अ 2-year-old will climb? 2-year-old, sir, he will have, most importantly, 2 feet at one step. 2 feet at one step. That's how a 2-year-old will walk on the stairs. 2 feet at one step. There is one step. He will put his one feet, then another feet on the same step. So 2 feet at the same step. 2 feet at one step. A baby can climb by 2 years. 3-year-old baby can climb alternate stairs like you and me. Normally they can climb, but can they come downstairs? No, they can't come downstairs. When can a baby come downstairs? A baby can come downstairs by 4 years. A baby can come downstairs by 4 years. Very good. Robin, Anurag, Shubhangi, Julie, Beautiful. People who are answering means they are another level. Okay. And okay, option number D, knows gender. Like I am Rahul, I am a boy, I'm 3 years old. So when can a baby knows his sex? Anyone? When can a baby knows his full name, age, and sex? Again, a baby knows his full name, age, and sex by 3 years, and a baby can go to toilet alone by 4 years. Okay, so yeah, are you understanding? Yeah, exactly. Ibza is right. A baby knows his full name, age, and sex by 3 years, and a baby can go to toilet by 4 years. So a 2-year-old baby. So I think the B is the best option. Next question. Yeah, good question. In which of the following CNS malignancy is seen in children? In which of the following CNS malignancy is seen in children? Options are Turner syndrome, neurofibromatosis, Fanconi syndrome, or Sturge-Weber syndrome. Anyone? Julie, what do you think? Very nice question of the CNS pediatric neurology. I've taken many classes on that. What do you think? A, B, C, D? Hmm. Very good, very good. So yes. Okay, B and D you say. Okay, option number B. Yeah, the best answer is nothing but neurofibromatosis. Yes, and NF is very importantly. So, which tumor? Can anyone tell me any optic nerve tumor or any which tumor is associated in a case of neurofibromatosis? Any CNS? I would say any tumor. Anyone? Do you know the name of the tumor? That in neurofibromatosis, if I'm suffering from type 1 and type 2, which tumor is associated? The answer is very importantly yes, in the eyes. Very good. Ibza is so good. Optic nerve glioma. Very, very important. Optic nerve glioma are present in NF1 in 15% of patients, and represent mostly low grade astrocytoma. So basically they are the main central nervous tumor. So optic nerve glioma I have told in the previous classes of the neurology, हमने डिस्कस की अच्छे से, ठीक है. So optic nerve glioma, CNS tumor, CNS malignancy which is seen in a case of neurofibromatosis. The answer is optic nerve glioma. Okay, we have a regular student. His name is To Be a Better Human in the Modern World. Very nice, long name, but nice name. Good, thumbs up. Next question. Yes, NF1 is the best answer. Yeah, good question. True about Wilson disease. Now, multiple options are correct. Everyone, multiple options are correct. Let's see if you can give the best answer. So, yes, what do you think? Anyone? Hari Mohan Chaudhary, Anurag. So beautiful people we have today. The more you participate, the more chances are there that you will clear this exam. Remember, guys, INI-CET is coming, FMG exam is coming, and NEET also is coming. तीनों एग्जाम तुम्हारे सर के ऊपर बैठ के ऐसे तांडव कर रहे हैं. तमीज से आंसर करो, सब लोग पार्टिसिपेट करो, तुम्हारा ही भला होगा. मेरे को तो लाइन बाय लाइन अच्छे से आता है. हाँ जी, वेरी गुड. सो मल्टीपल ऑप्शंस आर करेक्ट. दैट्स व्हाट आई एम सेइंग. यस. Julie says A, C, D, E. Okay, Chakravarti says A, C, D, E. Okay, let's see. So, such kya hai? What is true about the Wilson disease? Yes, the best answer is yes. The beautiful people who have answered very nice is our Julie. The first answer has been given best by Julie. Whosoever will answer best, I will put the name there. So, true about Wilson disease. Sir, Wilson. Sir, I'm a NEET PG student. Sir, Wilson, I'm not able to remember. Could you make me revise some 5 points? Yes, bro, it's very easy. Wilson, see Wilson. What is the problem in Wilson? Copper, copper everywhere. Remember, copper, copper everywhere. There's a copper deposition in my eyes, in my brain, in my liver, in my kidney, in my intestine. Everywhere there's a copper deposition, right? Everything increases, right? Urinary increases. Hepatic copper content in my body increases. Everything increases except ceruloplasmin. The serum ceruloplasmin level basically are less in a case of Wilson. This is number one. And very beautifully, Ibza says ATP7A. Is Ibza right, everyone? Ibza says ATP7A gene mutation you see in what you called Wilson disease. The answer is ATP7B. Ibza, remember dear, ATP7B gene mutation you see in Wilson disease. And where do you see ATP7A? Up now, Julie, what do you think? The answer is yes, very importantly, Menkes disease. Yes, very good, Prabhakar. So ATP7A gene mutation you see in Menkes disease, and ATP7B gene mutation you see in Wilson disease. So most importantly, serum ceruloplasmin level increases. KF ring. Now, very importantly, Kaiser-Fleischer ring in the Desmond membrane of my cornea. Let me show you one picture. This one, very importantly, this is the cornea, the Desmond membrane, the last one, the Desmond membrane of the cornea. You have the this copper deposition, nothing but forming a ring known as KF ring. Okay, now who will tell me? I'll give you a chocolate if you can tell me how do you look for KF ring? In which examination you will find the Kaiser-Fleischer ring? Just normal examination, ophthalmic examination, indirectly, direct ophthalmoscope. How? Anyone? Hmm. Very good. Slit lamp. Yes, slit lamp is the best answer by the slit lamp examination. Slit lamp. Oh, याद है इसमें तुम थोड़ी रखते हो अपनी. You put your chin, no, in that when machine is there and you look there and remember we have discussed about it. The doctor will be on that side, you'll be on this side. You will put your chin like that, and they will zoom it, and they'll see the KF ring in your eyes, known as slit lamp examination. Yes, and Julie has come with a very important homework. Yes, the homework is, yeah, very importantly, the homework is, if the mother has taken vitamin D, if the mother has taken vitamin D during pregnancy, the baby can land up into supravalvular aortic stenosis. That was the question I had asked in the previous classes. Take a supravalvular aortic stenosis. I'll repeat again. The most common congenital heart disease in Williams syndrome is supravalvular aortic stenosis. The most common congenital, the most, like, if the mother has taken vitamin D during pregnancy, the baby can land up into which congenital heart? The answer is supravalvular aortic stenosis. Are you understanding? Two questions, one answer. If the most common congenital heart in Williams syndrome is supravalvular aortic stenosis. If the mother has taken vitamin D during pregnancy, the baby can land up into supravalvular aortic stenosis. Very good. Next question. Yeah. So yeah, and what type of tremors do you see in Wilson? Yes, exactly. Yes, sir, revise कराओ सब फिर से सारे ड्रग. अच्छा ठीक है, अब कराता हूँ डियर. Okay. Ganja. Ganja, what's up, bro? I missed you. Did you miss me? Yes or no? Yes. So, what type of tremors do you see in Wilson disease? Anyone? What type of tremors do you see in Wilson disease? कोई नाम है उसका? Anyone? What do you think? Prabhakar. Yes, 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 yes. Okay, Prabhakar says, but in pregnancy we give vitamin D3. Excess of vitamin D. Excess if you give, the baby can have a heart defect, supravalvular aortic stenosis. Flapping tremors also, yes, and also you can say wing beating tremors. Wing beating tremors. Very, very important. Wing beating tremors you will see in what you called Wilson disease, that you should know. Okay, if the mother has taken cocaine during pregnancy, anyone? If the mother has taken cocaine during pregnancy, the baby can land up into which problem? Who will tell me? Cocaine, thalidomide, lithium. Yes, very importantly, anti-malarials. Okay, perfect. If the mother has taken cocaine during pregnancy, the baby can land up into microcephaly. Number one, first PG entrance question. NEET PG question number two. If the mother has taken thalidomide during pregnancy, the baby can land up into limb defect. Into which limb defect? Phocomelia. Phocomelia. If the mother has taken lithium during pregnancy, who will tell me, Prabhakar? If the mother has taken lithium during pregnancy, the baby can land up into box-shaped heart. Box-shaped heart. And where do you see box-shaped heart? The answer is Epstein anomaly. Epstein anomaly, that you should know. If the mother has taken erythromycin during pregnancy, the baby can land up into which problem? Ganja, Subhangi, cause. Very good. See, so beautiful you're answering. See, you guys will rock. You will get a rank one, no doubt about it. Okay? If the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis, CHPS. The baby can land up into congenital hypertrophic pyloric stenosis, right? This is one thing. Okay, next, if the mother has taken anti-malarials during pregnancy, the baby can land up into what problem? The answer is deafness. Deafness. The baby can land up into deafness, right? These are the important drugs we need to understand. If the mother has taken vitamin D, during pregnancy, the baby can land up into supravalvular aortic stenosis. supravalvular aortic stenosis. That also you should know. Okay, so I'll repeat again. If the mother has taken cocaine during pregnancy, the baby can land up into microcephaly. If the mother has taken thalidomide during pregnancy, the baby can land up into phocomelia. What is phocomelia, Julie? What is phocomelia? Limb defects. Limb defects. If the mother has taken lithium during pregnancy, the baby can land up into Epstein anomaly. If the mother has taken anti-malarials during pregnancy, the baby can land up into deafness. If the mother has taken erythromycin during pregnancy, the baby can land up into congenital hypertrophic pyloric stenosis. That and vitamin D का बता दिया, ठीक है? M से yeah, very good. If the mother has taken misoprostol, if the mother has taken misoprostol during pregnancy, the baby can land up into M for M for misoprostol, M for Mobius syndrome, which have nothing but cranial neuropathies. If the mother has taken misoprostol during pregnancy, the baby can land up into Mobius syndrome, which has nothing but various cranial neuropathies. Okay, and if the mother has taken danazol, if the mother has taken danazol during pregnancy, the baby can land up into virilization. If the mother has taken danazol during pregnancy, the baby can land up into virilization. लड़के में लड़कीपन, लड़की में लड़कापन. ठीक है? समझ में आ गया? Has everyone understood this much? Please put a like button. Please put a like button to this video if you are able to understand what I am trying to tell you. Okay. What is this picture showing? Anyone? Hanji, Supratik, Ibza. What are you able to understand in this picture? Who will tell me? We want rank 1 without fail. Without fail. जान से मार दूं अगर नहीं आई rank 1 तो. Hanji, what is this? Anyone? What is this picture? Can anyone appreciate this very importantly? Yes, beautiful, beautiful. Yeah, this is nothing but yeah. आज एक गाना सुनाओ. ठीक है, सुनाता हूँ. एंड में सुनाएंगे. एंड में सुना. ठीक है. This is nothing but KF ring. This is nothing but KF ring. This is nothing but KF ring. Kaiser Fleischer ring. That's important. Next question. हो गया, आसान है. Okay, what is this milestone? What is this milestone? What is this? This is nothing. What is ganja? This is ganja playing with the tricycle. So when can a baby ride a tricycle? What is your age? What is this one? The answer is 3 years. A baby can ride a tricycle by 3 years. Very good, Supratik. Hari Mohan, Robin, beautiful. Priya, beautiful. Right cycle. Yes. When can a baby do hopping and skipping? Who will tell me? एक बच्चा hopping कब करता है और एक बच्चा skipping कब करता है? Anyone? Hopping and skipping? Anyone? So yeah, a baby can do hopping by anyone? Yes, a baby can do hopping by 4 years and skipping by 5 years. Skipping by 5 years. ठीक है? Actually, I'm talking to you, you guys. तो मुझे ना एक आइडियाज़ आ रहे हैं, अजीब अजीब से आइडियाज़ आ रहे हैं. अजीब अजीब से मतलब कि मुझे और कैसे अच्छे तरीके से मैं पढ़ा सकता हूँ. जैसे मेरे देखो इसमें मेरे अपनी नीस को ना वो बोला हुआ है. आई हैव गिवन हर 3 sketch pen and she is telling once. Yeah, I have given her my niece. I have given her 3 sketch pen, and I'm telling her, like, she's telling that I have 3 sketch pens with me. One is black. Okay, so my niece, she has 3 sketch pen. One is black. Okay, another one was green, and another one she has is yellow. So where do you see this in pediatrics? Anyone? Anyone? What do you think? Question समझ में आ गया नहीं आया? These 3 sketch colors, do you see anywhere else in pediatrics? Yes or no? Yes or no? What do you think? Yes, 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 yes. Very good. Very, very, very good. हाँ, कौन बताएगा इसको? Exactly. 3, 4, 5. नहीं, वो तो हो गया. 3 sketch colors I am telling you: black, green, and yellow. So do you see this sketch color anywhere else or nowhere else? So yes, the answer is the first tool that the baby passes is the meconium, and that is black in color or blackish green in color. Green color stool which the baby pass, that is nothing but transition stool. That is nothing but transition stool. And the yellow color which the baby pass, that is the mature stool. That is the mature stool. So these are the 3 stool colors which I was asking in the video. अच्छा ना, ठीक है. And this Robin says cannula bro, पर ब्लैक कलर का कैनुला नहीं होता ना. अगेन समवन सिंग बट शाकी टेप, शाकी में ग्रीन होता है, येलो होता है, पर ब्लैक तो नहीं होता. ब्लैक की जगह क्या होता है? रेड होता है. रेड अगर रेड है तो कितना होगा MUSC? एनीवन टेल मी फास्ट फास्ट. इन द शाकी टेप यू हैव रेड कलर you got in the shaky tape. Then red color will be which number? Cannula, who will tell me? Yes, very good. Perfect. Beautiful. Super fantabulous answer. Yes, red will be the MUAC will be less than 11.5 centimeter. And then you have yellow. Yellow will be less than 12.5 centimeter. And green will be more than 12.5. Green will be more than 12.5. याद है कि नहीं याद है everyone? Julie, you remember this? Yes, perfect. You are remembering? That's perfect. Again, we have a motivating quote in between which says, grow through what you go through. Grow through what you go through. There are problems in life. Everyone have issues in life. Everyone has problem, but grow through what you go through. Okay, don't be bitter by past, be better by past. Are you understanding? Don't be bitter by past, be better by past. Next question. Yeah. Okay, so what are the milestones you can see in the picture? Anurag, Julie, dear, what do you think, bro? Supratik, कौन से milestones you can appreciate in the picture? Nowadays in the AIMS question and INA-CET, they are asking this video-based question. They'll just play the video. What all milestones can be achieved, can be seen in the picture? Can we see a bidextrous approach or a unidextrous approach? ये क्या बोलते हैं? What do you call this? Anyone? Is this a unidextrous approach or a bidextrous approach? So beautiful, very good, Anurag. Julie, yes, we can appreciate a unidextrous approach. Number one, can we appreciate mouthing? Yes or no? जो भी दो मुंह में डाल लेता है, जो भी दो मुंह में डाल लेता है, yes or no? Exactly. Chandravarti is so good, very good. So I'll repeat again. Is holding something with both the hands is known as bidextrous approach, and holding something with one hand is known as unidextrous approach. So bidextrous approach comes by 4 months, and uni holding something with one hand, unidextrous approach comes by 6 months. Number one. Number two, very importantly, mouthing. When does mouthing comes? Mouthing means, most importantly, mouthing. Mouthing means whatever you give, he puts in the mouth. Whatever we give, he puts in the mouth. So mouthing comes by 5 months. Mouthing comes by 5 months. That also very important. You should know. Are you understanding, dear? So this is important, right? That you should know. Okay, ये mouthing है, कुछ नहीं है. ये mouth is also mouthing, cute mouthing. This is the cutest mouthing you can ever see. Cutest mouthing. Mouthing comes by 5 months. 5 months. ठीक है, that you should know. Okay, what is this milestone? Anyone? Tell me fast. What is this milestone? Shubhangi, Hari Mohan, people who will reply will get the rank 1. Do you want to get rank 1? Oh, you don't want rank 1? Don't reply. Please don't reply on the comment section. If you don't want rank 1, no, please don't reply. Only rank 1 student should reply. Rank 2 and 3, wait for 6 months. Anji, what do you think? Can we appreciate transferring objects from one hand to another? Achha, I gave a kiss also. That also I saw. It's cute. I like that. Flying kiss. हाँ जी, क्या बोलते हैं इसको? When can a baby transfer objects from one hand to another? Yes or no? Transferring objects from one hand to another comes by roughly around 6 to 7 months, right? If I say transferring objects from one hand to another is nothing but comes by 6 to 7 months. 6 to 7 months. Number one. Number two, what are the milestones? Anyone tell me fast. Look at the picture and tell the diagnosis. Look at the picture and tell the diagnosis. Who will tell me? Anurag, Julie, Supratik, Shubhangi, Ibza. I mean, these are the toppers I'm telling you gonna be in NEET PG. Shubhangi, very good. Ibza, Prabhakar, Saha, yes. So what is this milestone, yaar? This is nothing but, can we see a unidextrous approach? Yes or no? He's holding something with one hand. Can we see kind of a unidextrous approach? It comes by unidextrous approach comes by 6 months. Number one. Mouthing, जो भी दो ये मुंह में डाल रहा है Q2 this Q2 must be 5 months old. Okay, that you should know. Done. Next question. अच्छा, ये तो आसान है. अच्छा, this is a good question. Now there are 4 type of grasp to get a rank 1 in the NEET PG. 4 type of grasp you should know. One is palmer grasp. If there's a toffee holding not like this, with the palmer aspect. One is radial aspect. One is palmer aspect, radial aspect, immature pencil grasp, and mature pencil grasp. Does anyone remember the names? Yes or no? Yes. So remember 6 months and 8 months. So if this is something, a small pebble is there, holding not like this, holding on the palmer, like through the palmer aspect of the hand, that comes by 6 months. And holding something like this. Okay, let's say this is the radial part, and this is the radial part. So holding something like this is the radial grasp, comes by 8 months. Holding something with the thumb, index finger, and assisted fingers, that is known as immature pincer grasp. That is known as immature pincer grass. Are you understanding? That comes by 9 months. And what about mature pincer grass? Mature pincer grass, it comes by 12 months. Mature pincer grass comes by 12 months. These four graphs are really important, bro. Palmer grass comes by 6 months. Radial grasp comes by 8 months. Immature pincer grasp comes by, most importantly, what you called 9 months. And mature pincer grass comes by 12 months. 12 months. Is everyone understanding? Yes or no? Okay. Acha, one more thing also I want to ask you, everyone. So many are there online today. Listen, we are doing an integrated session with dermatology, and also we are doing one integrated session with the pathology. So derma and pathology. So anyone, Anurag, Supratik, Julie, Shubhangi, and Chakravarti. Pedia with Dr. Cheshta. I'm doing, like, with Dr. Cheshta, we have dermatologist. I'm doing an integrated session with her this month. And have you heard of Dr. Priyanka Sachdev? Yes or no? Have you heard of Dr. Priyanka Sachdev? She speaks like that. Am I audible visible? Am I audible visible to everyone? Hello, good morning, everyone. Am I audible visible? ऐसे बोलते हैं ना? She's very cute. I really find her very cute. So pathology, I am going to do one integrated session with Dr. Priyanka Sachdev, and for Dharma, I am doing with Dr. Cheshta. What I want from you guys is, do you want any topic of something of dermatology which is connected with pedia? Like, do you want to study any topic? For example, if I talk about dermatology, right? If I talk about measles, right? Measles is a derma topic also, pediatrics topic also. Mumps, it is a dermatological problem also, and pedia also. If I talk about chicken pox, very similar. Are you understanding? So chicken pox, what kind of rash do you see in chicken pox? अच्छे से पढ़ा है, बता दो. Maculopapular vesicular rash. Yes or no? Chicken pox, पानी वाले दाने, vesicular rash. So that's what I'm saying. We are planning to do an integrated session with the pedia with derma and pedia with patho. So if you have anything in mind, any topics you guys feel you want to study again, revise again, or you want some amazing session, let me know. Okay, so we have what you called atopic dermatitis. Okay, yes. Yes, Chakravarti is good. Okay, fine Chakravarti. And ortho, अच्छा, Hari Mohan Chaudhary says do one ortho session. ठीक है, मैं आज ही अपने टीम मैनेजर से बात करता हूँ. PDN ortho भी लेके आएंगे. This month, like, I want to do a lot of integrated sessions, which will be really helpful for us to learn pediatrics in a beautiful way, right? Next question. Okay, so yes. What is this? Anyone? What is this milestone? Who will tell me? Yeah. Now, what is this? Yeah. What is this milestone? Is this वो, हाँ, okay, ये तो हर चीज मुंह में डालेगा. ये सावन पे गया है, जो देखो मुंह में डाल लेता है. So what is this milestone? Who will tell me? Anyone? Yes or no? So yes, this is a very beautiful milestone on what is this? Yes, grasping. Yeah, exactly. Grasping. And you can say it's more of a radial grasp. Kind of, he's holding, if he was holding something with the palm, or it was different. This looks like a radial grasp, or you can say immature pincer grasp also. Okay, now next question is cute baby. Cute. This baby is very cute. Nothing. There's no milestone. This baby I like white Chinese color. I don't know. I'll buy one more shirt. White color, like, looks good on me. Anji, anyone? Let's can we just finish fast? Vitals of a normal term unit. Tell me very fast. What is the normal heart rate of a newborn? What is the normal heart rate of a newborn? Yes or yes. What do you think? Anyone? What is the normal heart rate of a newborn? Who will tell me? Yes. What is the normal respiratory rate of a newborn? Very good. Chakravarti is answering so good. The normal heart rate of a newborn is 120 to 160 beats per minute. Yes, that's a beautiful answer. What's the normal respiratory rate of a newborn? Yes, very importantly, Julie told the right answer. The respiratory rate of a newborn is 40 to 60. 40 to 60 cycles per minute is the normal respiratory rate of a newborn. CFT. What is CFT, Julie? What is it? Julie again is answering very well. Whosoever will answer his or her name, I will write. CFT is nothing but capillary filling time. CFT is nothing but capillary filling time is nothing but less than 3 seconds. Less than 3 seconds, right? Less than 3 seconds. Very good. So luckily no one is answering wrong actually. So yeah, capillary filling time, nothing but I'll put my finger on the patient's sternum, and I will count 1001, 1002, 1003. Then I will leave my finger and keep counting 1004, 1005. So normally whatever that discoloration which has happened because of my finger, I'm seeing in how many seconds? that discoloration goes back to normal. So normally the CFT is less than 3 seconds. Less than 3 seconds means if I keep my finger over here and say 1001, 1002, 1003, then I'll keep counting 1004, 1005. By 1005, nothing but less than 3 seconds, my CFT should go back to normal. That's what you should know. Okay, any cyanosis? Do you see cyanosis in a newborn? Yes. Which cyanosis? Acrocyanosis. Acro. What's the meaning of acrocyanosis? Anyone? What is the meaning of acro? Acro means, who will tell me? Supratik? Exactly. Chakravarti is right. Acro means periphery. Acro means periphery and cyanosis means bluish discoloration. True. And any murmur? Do you see any murmur in a newborn? Yes. Soft ejection systolic murmur. Soft ejection systolic murmur you will see in the newborn. That's a normal, this one, what do you call, normal phenomenon. Next question. What is the best way to start the kangaroo mother care? Who will tell me? Good question. What is the best way for KMC? Anyone? Hmm. Yes, very good. The best weight for starting a kangaroo mother care is, who will tell me? Yes, the answer is 1800 grams. 1800 grams is the best weight. 1800 grams is the best weight to take the to start a KMC in a baby. Yes, 1.8 kg. Yes, that's true. Very true. Okay, कब तक करना है? Till how long should I do? Anyone? कब तक करना है? Till how long? When the baby is 2 kg, 3 kg, 5 kg. Till when should I do the kangaroo mother care? Who will tell me? Yes, अनुराग, सुप्रतीक, ACTH वेट सिंड्रोम, ये कहाँ से आई लाइन? ये बात कहाँ से आई? ACTH वेट सिंड्रोम. Okay, yes, who will tell me? The answer is 2.5 kg. 2.5 kg. You will do till the baby achieves 2.5 kg. I'll repeat. Yes, ganja is very good. Who wrote this answer, right? ओसामा आ गया. ओसामा, क्या हाल है मेरे भाई? कई दिन हो गए. ठीक है तू? ओसामा शेख, कैसा है तू? ठीक है, बढ़िया ब्रो. याद करता है? याद करते हो? कितना याद करते हो? कितना याद करते हो? इतना? इतना? या फिर इतना? और हाँ, ठीक है, वेरी गुड. अच्छा, ये भी हो गया. हाँ, सो व्हेन कैन आई, कब तक करना है एग्जैक्टली? अंटिल द बेबी टॉलरेट्स और अंटिल, नहीं नहीं, सी व्हाट कॉल्ड शुभांगी, इफ माय क्वेश्चन वाज इन हाउ मेनी आवर्स पर डे, how many hours per day I should do the KMC. Usually they say 1 to 2 hours per sitting, but you can go for many hours. Then you can write this answer until the baby tolerates. How do you know the baby is tolerating or not tolerating? Number one, forehead sweating. If the baby is having forehead sweating, means the baby is not tolerating, and himself the baby starts crying. So till that long you can do KMC. My question was, when can I stop KMC? The answer is when once the baby reaches 2.5 kg or once the baby reaches term gestation. Done. Please read the question and tell me the best answer. Recent question 2017. ओसामा कह रहा है आपको बहुत ज़्यादा मिस किया. उसी समय आपको गुड इवनिंग किया, बट सर आपने रीड नहीं किया मेरा कमेंट. सॉरी ब्रो, सॉरी. मैं प्यार तो बहुत करता हूँ ना, तो मैं सॉरी यार. ठीक है. Which of the following is a component of kangaroo mother care? Options are incubator, heat therapy, exclusive breastfeeding, and phototherapy. The answer is exclusive breastfeeding. Exclusive breastfeeding is the very importantly following a good component, important component of kangaroo mother care. When do you celebrate breastfeeding day? Anyone? When do you celebrate breastfeeding day? Let's revise everything possible today. Anji, Aditya, 10 more minutes, then this class is over. 6 o'clock, I have to go to gym. आज जिम बंद है, but I'll go. My भाभी, she has got me a nice cycle for my birthday. So आज साइकिल पे जाएंगे, ईयरफोन्स लगा के लाउड म्यूजिक पे गाने सुनते हुए जाएंगे. What do you think? आज थाइस भी करूँगा एक्सरसाइज. पुशअप्स मारूंगा अच्छे से. ओसामा, मेरी फोटो देखी तूने? ओसामा, IG पे लगाइए. IG पे फोटो देखी मेरी? एब्स बन रहे हैं? बता दियो यार अगर एब्स बन रहे नहीं बन रहे. हाँ जी. Yes, exactly. Osama is right. Breastfeeding we do not celebrate on a day. We celebrate week, first week of August. Very good. Breastfeeding week we celebrate in the first week of August. When do you celebrate National Neonatology Week? Who will tell me? National Neonatology Week. Fast, fast, very fast. The more fast you answer, the more fast I will ask you the next question. Exactly. 15 to 21st November. Yeah, 15 to 21st November is what we celebrate National Neonatology Week. 15 to 21st November. हाँ जी, हम्टी डॉन कह रहा है कौन सा सॉन्ग सर? सॉन्ग नहीं बोला ब्रो, मैंने पिक लगाया था उस पे, स्टेटस पे। उसामा देखा तूने? ठीक है, परफेक्ट, वेरी गुड। ठीक है, द फर्स्ट वीक ऑफ अगस्त वी हैव ब्रेस्ट फीडिंग वीक, नेशनल न्यूनेटोलॉजी वीक इज इन 15 to 21st of November, अगेन दैट्स वीक। व्हेन डू यू सेलिब्रेट डॉक्टर्स डे? हु विल टेल मी डॉक्टर्स डे कब आता है? डॉक्टर्स डे, वेरी गुड। डॉक्टर्स डे वी सेलिब्रेट ऑन 1st July, 1st July we celebrate doctors day। when do you celebrate world malaria day? malaria day, anyone? मलेरिया मुझे याद नहीं है, कौन बताएगा मलेरिया? who will tell me मलेरिया? yes। हम्म। हम्म। 25th of April, yes, true। World Environment Day, World Environment Day, World वातावरण दिन, anyone? Yes, very good। The answer is 5th June। So beautiful you guys answering, my god, everyone knows the answers, everyone is a topper here, right? I'm बता रहा हूँ मैं। अच्छा। अच्छा, ये बताओ 28 सितंबर को क्या आता है? 28 सितंबर को क्या आता है? हु विल टेल मी व्हाट कम्स ऑन 28 सितंबर? 7th अप्रैल। हाँ, 7th अप्रैल क्या आता है? जूली क्या आता है? इधर इधर आओ, इधर आओ, तू इधर आ। 7th अप्रैल तुमने लिखा से, इधर आओ तुम पहले। 7th अप्रैल क्या? तुम्हारे बॉयफ्रेंड का बर्थडे है उस दिन। 7th अप्रैल क्या आता है? 7th अप्रैल को कुछ नहीं आता। 7th अप्रैल को मेरी मम्मी का बर्थडे आता है 13th अप्रैल को। ठीक है। यस। सो 28 सितंबर को वर्ल्ड रेबीज डे, वर्ल्ड रेबीज डे, वेरी ट्रू, वेरी ब्यूटिफुल, यस। या, डन, नेक्स्ट क्वेश्चन। ओके, प्लीज रीड दिस वन। विच ऑफ द फॉलोइंग इज नॉट अ component of kangaroo mother care? Anyone? What do you think? चक्रवर्ती, आदित्य, गौतम, शुभांगी, ओसामा, ब्यूटिफुल। विच ऑफ द फॉलोइंग इज नॉट अ component of the kangaroo mother care? हाँ जी, कौन बताएगा, कौन बताएगा, कौन बताएगा, कौन बताएगा, कौन बताएगा? हाँ जी, मैं बताऊंगा, मैं बताऊं, मैं बताऊं, नहीं, कौन बताएगा? Yes, exactly. Is skin to skin a component of kangaroo mother care? Hanji, yes sir, it is a component. Exclusive breastfeeding, is this a component of kangaroo mother care? Hanji। जितना जल्दी माँ दूध पिलाएगी उतना जल्दी बच्चा डिस्चार्ज होगा और फॉलो अप होगा। हाँ जी सर, इट इज अ component। So which is not a component? Supplementary nutrition, supplementary nutrition is not a component of the kangaroo mother care। And normally what supplementary nutrition do we give to a newborn? Anyone? कोई न्यूबॉर्न बेबी कुछ देते हैं अदर देन मदर मिल्क? डू वी गिव एनीथिंग एल्स टू अ न्यूबॉर्न? ओसामा, शुभांगी, एंड सुप्रतिक, yes, ganja, what do you think? Priya, do we give any nutrients to the baby, any other additional supplements, any? Yes or no? कौन सा क्या देते हैं? ओके, सुरभि गौतम से कुछ नहीं देते, कुछ नहीं देते, देते हैं, देते हैं। सुरभि, क्या देते हैं? तुम क्या देते हैं? तुम्हारा नंबर नहीं। vitamin D and vitamin K, yes or no? Breast milk is deficient in which vitamin? Vitamin D, vitamin K, and vitamin B12 if she is a pure vegetarian. How much vitamin D do you give to a newborn? 400 IU if that baby is term, and 800 IU if the baby is preterm। 400 IU if the baby is term baby, and 800 IU, IU means international units। ठीक है। अच्छा, और कोई सिरप है जो इंटरनेशनल यूनिट्स के फॉर्म में देते हैं? मान जाऊंगा अगर कोई बता दे मुझे, भगवान की दया से। एनी वन ऑफ यू कैन टेल मी, डू वी हैव एनी अदर सिरप विच इज गिवन इन द फॉर्म ऑफ व्हाट यू कॉल, अपना क्या कहते हैं उसको, इंटरनेशनल यूनिट्स? एनीवन? एनीवन? कोई और सिरप है जो हम इंटरनेशनल यूनिट्स के हिसाब से देते हैं? एनीवन? एग्जैक्टली, किसने बोला ये आंसर? वेरी गुड, वेरी गुड, शगुफ्ता परवीन, वेरी गुड शगुफ्ता, शगुफ्ता इज वेरी राइट। विटामिन ए हम देते हैं, कितना देते हैं यूजुअली सैम के बेबीज में? लेस देन 6 months, यस, वेरी गुड। लेस देन 6 months 50,000 IU, 6 months to 1 year 1 lakh IU, and more than 1 year 2 lakh IU, right? This is what we give. This is what we give, right? Less than 6 months, 50,000 IU, 6 months to 1 year, 1 lakh IU, and more than 1 year, 2 lakh IU, right? Number one. And vitamin K, vitamin K, vitamin K, do we give to a newborn? Like, what is the dose of vitamin K? Very good buddy। Osama, क्या बोलते हैं उसको, vitamin K, normally we give 1 milligram। If the baby is less than 1 kg, then we give half the dose, 0.5 milligram। Okay, and one more thing, vitamin A, I hope what you called, if more than 1 year, you give 2 lakh international units of vitamin A. If the child is more than 1 year but less than 8 kg, less than 8 kg, then how much do you give? 1 lakh. Then you give only 1 lakh international units. That you should know, na, vitamin A. Okay, very good. Perfect. Please read this question and tell the answer. AIMS November 2016. What do you think? Anyone? Fast, fast, fast. What do you think? Easy question. Jaldi batao. हम्म। अनुराग भी अच्छा आंसर कर रहा है वैसे। अनुराग तुम कहाँ से हो? नए नए स्टूडेंट हो, तुम्हारा कभी मैंने नाम सुना नहीं। जूली का तो बहुत सुना है। शगुफ्ता, सुप्रतीक, टू बी बेटर इन दैट मॉडर्न वर्ल्ड, वो बंदा। हाँ जी, अनुराग, वेयर आर यू फ्रॉम? Yes, right. So, yes, we all know that what is the recommended dose of steroid for attaining fetal lung maturity? So, sir, A, B, C, D. A, B, C, D होता है B for betamethasone, D for dexamethasone. Sir, B comes at the second place. So, two doses of betamethasone is given. D comes at fourth place. So, four doses of Dexa is given. Sir, the mnemonic is 12 into 2 is 24. So, 12 mg. Exactly. So betamethasone, right? Betamethasone, yeah, exactly. So 12 mg, two doses, 24 hours apart. We give 12 mg, two doses, 24 hours apart. Okay, that is betamethasone. Right, yeah. 12 mg, two doses, 24 hours apart. How will I remember? 12 into 2 is 24. 12 into 2 is 24. Are you understanding? And what about Dexa? Who will tell me what is the dose of Dexa? What is the dose of Dexa? Anyone? Yes, very good, very good. What is the dose of Dexa? Perfect answer. Perfect. So Dexa कितना देते हैं? Yeah. अगर this we give 12 mg betamethasone, then Dexa is given 6 mg, right? If this is given two doses, it is given four doses and 6 hours apart. 6 hours apart, right? Exactly 6 hours apart, and yeah, we give that. Next question. Yeah. क्या लिखा है मैंने, ये मुझे पता ही नहीं। अच्छा, if the Apgar score, if a baby's Apgar is, I want to ask you one thing. Okay, 4. A newborn baby Apgar is 4. Oh, who will tell me? Anyone? Anyone? Acha, Chakravarti says, in hospital, Chakravarti, in my medical college, they give Dexa. Okay, we don't have betamethasone in our hospital. These, they all gynae people, they all give Dexa, Dexa, Dexa. Exactly. 6 mg, four times up, yeah, four doses and 12 hours apart. Yes. If the Apgar is 4, then what is the interpretation? NEET PG 2019 question. 2019. The answer is moderately asphyxiated baby or moderately depressed baby. Yes. What is the normal Apgar score? Who will tell me very fast? Very fast. Tell me what is the normal Apgar score? Who will tell me? Priya, Supratik, Shagufta, Osama, Aditya, Prabhakar Saha. What is the normal Apgar score? Anyone? एक गलत आंसर दो, मैं बताता हूँ फिर क्या करना है। More than 7, thank God. That's right. So Bhavani Singh Rathore, Bhavani, 8 to 10. Yeah, you can say, yeah, more than 7. More than 7. ये नए नए लोग आए हैं. Happy says more than 8. Shagupta says 8. So more than 8 नहीं, more than 7 is normal Apgar score that you should. Okay, exactly. So what do you think? Apgar score includes all of the following except A, B, C. What do you think? 2016, 2017, the question comes multiple time. Anyone? Shagupta? Shubhangi? Hmm. Exactly. The best answer is respiratory rate a part of Apgar score? The answer is no. Respiratory rate is not a part of Apgar score. It is the respiration or respiratory efforts. The RR is not a part of Apgar score. Again, 5 more minutes, then this class is over. There are two ways of spreading the light. There are two ways of spreading the light. Be the candle or the mirror that reflects it. Such a beautiful quote. Can we appreciate this? Yes or no? There are two ways of spreading the light. Either you be the candle, or if you can't be the candle, you be the mirror that reflects it. So that's beautiful. So what do you think, guys? Shagufta, Aditya, Supratik, are you the candle or are you the mirror? So how many of you are the candle and how many of you are the mirrors? What do you think? Shivam? शिवम गुप्ता से सॉन्ग सोच रहा हूँ मैं सॉन्ग। रुक जाओ 2 मिनट, अभी क्लास खत्म नहीं हुई है, 5 मिनट पढ़े हैं अभी, पढ़ लो 2 सेकंड के लिए और। गाना कौन सा सुनाएंगे वाला? जो तुमने सुना ना, मुझे तो लिस्ट बनानी पड़ेगी कौन से गाने आप लोगों ने नहीं सुन रखे हैं। Okay. Yes, exactly. So either you be the candle or the mirror that reflects it. So we have to be emotionally independent. Listen, every one of you. कल मैं रहूं ना रहूं, over here you never know. The moral of the story is be emotionally independent. आओगे तो welcome. Tell this to the whole planet. आओगे तो welcome. जाओगे तो भीड़ कम. ठीक है? So you have nothing to lose. You have nothing to lose. Please, everyone, listen. You have nothing to lose in life, okay? Remember that. You have to be really mature. Every day someone will not be there to inspire you. Someday you have to being lonely, you have to inspire yourself. Okay, so you don't have to wait someone to inspire you. So be emotionally independent, and remember, the day you remember that you have nothing to lose, anyone coming in your life, very good, come, welcome, thank you, you came. Anyone wants to go, I can understand you want to leave, I can understand you must leave, I can understand you, please leave. Are you understanding? Why are you leaving? Oh, why God has done this to me? Every problem is there in my life only. Oh, I'm so sad. Oh, I have struggled so much in life. No, don't do all that drama. No one has time. Specifically, I don't definitely don't have such time for such creatures. Be emotionally independent. Everything happens for a reason. Acceptance is the key, dear. I'm telling you, whatever happens, accept it ASAP, and then think how best you can, flourish yourself in those situations, right? So that's what. So you have nothing to lose. If anyone coming in your life, very good. If anyone wants to leave, excellent. If outside it is raining, very good. If it's very hot summer, very, very good. I'm happy, I'll stay at home. So try to find positive in everything, and then only and only positive things happen in you. I'm telling you, your whole aura will change. Your way of living life will change. Your every single second, the way you breathe also will change. Are you understanding? That's important. Okay. So anyone, yeah, let's do this exactly. Let's 5 more minutes and this class is over. Please put your best vibes and good vibes and finish this class. It's 5:52, 5:57. We have to finish the class because 6 o'clock I have to go to gym. So in a neonate, cessation of breathing for 20 seconds. Cessation of breathing for 20 seconds is known as anyone? Yes, exactly. Apnea. Have you heard of apnea of prematurity? Exactly. Very good. So what is the drug of choice for apnea of prematurity? Any newborn baby, have you heard of apnea of prematurity? Yes or no? First, if you're a newcomer, remember, dear, the more the baby is premature, the more the baby can go into apnea. What is apnea, sir? Apnea, dear, apnea is any neonate who is cessation of breathing for more than 20 seconds. Any newborn who can hold his breath for more than 20 seconds, I will categorize that this baby is a case of apnea of prematurity, right? And what is the drug of choice for apnea of prematurity? Osama Sheikh, one of my very good what you call juniors, is very, very right. The drug of choice for what you called apnea of prematurity is nothing but caffeine citrate. Caffeine citrate is the drug of choice for the apnea of prematurity. Done? Done. Very good. Perfect. हाँ जी कुछ कह रहा था this one एक second. In the meantime I will हाँ please read this question. It was a AIMS question recent last year and read this question. I will read your comments. ओसामा कह रहा है सर ये सब ड्रामा देख लिया, मेरा हार्ट कैल्सिफाइड हो चुका है, अब नहीं पिघलता. वेरी गुड. मेरा भी हार्ट कैल्सिफाइड हो चुका है. कभी कभी तो लगता है कि मेरे अंदर हार्ट उस चैम्बर पे, मतलब वो एरिया में हार्ट है भी कि नहीं. मैं तो कभी कभी ये सोचता हूँ. पता नहीं ज़िंदगी में इतना संघर्ष देख लिया ना, इतना संघर्ष देख लिया कि मतलब फिर अब तो किसी पे विश्वास नहीं होता. अब तो बस यही लगता है कि भाई हम ही हैं जो हैं, और खुशियाँ भी हम ही ने ही पानी है, खुश भी खुद ही से ही रहना है, और खुद के लिए पहले करना है फिर किसी और के लिए. एंड ऑफ कोर्स इन दीज थिंग्स फैमिली डजंट कम. फैमिली इज़ फैमिली, फैमिली की तो कोई तुलना ही नहीं है. आई एम जस्ट टॉकिंग अबाउट द आउटसाइड वर्ल्ड. प्रॉब्लम 99% प्रॉब्लम हम क्या करते हैं, वी गिव द की ऑफ आवर हार्ट टू समवन एल्स. We give the key of our life to someone else, that if you will be nice to me, then my life is very good. I've seen people, you might have seen people, everyone is like that only, so it's a waste of time. Yes. So Ganja says something very happily. I have accepted ASAP. I have lost my hair but couldn't flourish it. That's okay, bro. Nowadays, clean head is in trend. It's in trend. Girls like guys who is clean shave and very neat. Yes, exactly. Beautiful. So Anurag says he's from Medical College Gorakhpur. Very good, Anurag. So A B C D. What do you think? Okay, so someone says A, someone says B and C. What is this? A, इधर आ जाओ तुम, इधर आओ जरा. बातें कराओ तो क्वेश्चन तुम्हारे हिलने डुलने लगते हैं. After the delivery of an infant of diabetic mother, the glucose of the infant was 40. What is the normal RBS of a newborn? Anyone? So less than 45, right? Less than 45 is hypoglycemia. So more than 45, we assume it is normal RBS. So this baby का कितना आया? 40 RBS came of this baby. RBS means random blood sugar. The question is, which other investigation does the sister expects that the physician would ask her to do? Very nice question. So if I'm a doctor and you are the sister, and telling sister, baby ka RBS kam aaya hai, the baby's random blood sugar is less. Please take the what you call blood glucose, what you called sample, and also with the blood glucose, what other sample will I tell the sister to take? The answer is calcium. Yes, very good, Prabhakar Sahab, very nice, exactly. And ये जूली ने क्या आंसर दिया है? पोटेशियम। क्यों पोटेशियम? क्यों पोटेशियम? क्यों? इधर आओ तुम इधर ही आ जाओ तुम। पोटेशियम क्यों? तुम्हें पसंद है पोटेशियम? कहाँ यूज होता है पोटेशियम? तो सैम में होता है। और पोटेशियम के सिरप का नाम क्या है? पोटेशियम के सिरप का सिरप पॉटक्लोर, सिरप पॉटक्लोर नाम है। यस, कितने में कितना होता है एनीवन? व्हाट इज द कंपोजिशन ऑफ सिरप पॉटक्लोर? एनीवन एग्जैक्टली? हम्प्टी डॉन से सर इन अ न्यू बॉर्न फ्रॉम डायबिटिक मदर, बच्चा में क्या होगा? हाइपोग्लाइसीमिया होगा। Yes, dear, we have done this also. If you don't know, I'll tell you. There's something known as Pedersen's hypothesis. There is something known as Pedersen's hypothesis, which is nothing but what says that if the mother is in a case of infant of diabetic mother, the mother will be hyperglycemic. The mother will be hyperglycemic and the baby will be hypoglycemic. The mother will be hyperglycemic and the baby will be hypoglycemic. And the best answer for this question is nothing but calcium. Please remember, my dear friends, hypoglycemia and hypocalcemia, they happens together. Hypoglycemia and hypocalcememia happens together. If the so that's the answer is, if the mother is what you called mother, if the answer is, if the mother, if the baby is hypoglycemic, other than the random blood sugar, I will check the calcium levels also. So hypoglycemia and hypocalcemia happens together, number one. And number two, very importantly, Humpty Don dear, the mother will be hyperglycemic and the baby will be hypoglycemic. Hypoglycemic. Remember, okay? And why does it happen? Anyone? Can anyone tell me होता क्यों है ये? Humpty Don क्यों होता है dear ये वाला? Exactly. Yes. Someone gave me a blue hat on Unacademy. I don't know who gave. ओके फाइन। सो हाँ जी, क्यों होता है? शगुफ्ता इधर आ जाओ तुम। शगुफ्ता, डियर शुभांगी, शुभांगी तुम बहुत अच्छी उससे हो, बताओ क्यों होता है ये, बताओ। हाँ एग्जैक्टली वो सारा भाई में, सारा भाई वर्सेस में बोलते हैं ना, माया कहती है मोनिशा को, मोनिशा बेटा तुम तो बहुत वैल्यूड वाले मिडिल क्लास घर से हो, तुमने क्यों चोरी की? ऐसे था हाँ। Insulin, exactly. So what happens? Most importantly, yes, there is, yeah, exactly. So see, there is insulin deficiency in the mother. There is insulin deficiency, right? Mother is diabetic. No, in diabetic you take injection, right? You take insulin injection. Why do you take insulin injection? Because you have insulin ka deficiency. Yes or no? So imagine, my dear, please listen to me for the first and last time. And मोती की तरह आपको याद होना चाहिए. In a case of diabetic mother, number one, mother is having diabetes. If the mother is having diabetes, she will be taking insulin injections. Imagine, she will be taking insulin injections, right? What does the function of insulin? Sir, insulin converts glucose into glycogen. ठीक है? Glucose into glycogen. ठीक है? Glucose into glycogen. Now, normally what happens, as I'm telling that mother is taking insulin injection means there is insulin deficiency. Yes or no? There will be insulin deficiency, right? There is a, what I'm trying to say is there is insulin problem in the mother. So there is insulin deficiency in diabetes means glucose will not be able to get into converted into glycogen. Yes or no? Normally insulin causes conversion of glucose into glycogen. I am having diabetes, I have insulin deficiency. I have insulin deficiency, right? So glucose will not be able to get converted into glycogen, right? So what will happen? The mother will be hyperglycemic or hypoglycemic. What do you think? Anyone? Hanji, Shubhangi. Shubhangi लेती है इंसुलिन. Okay dear, बताओ जल्दी. Osama, yes, very good. So mother will be hyperglycemic. No, because too much of glucose, glucose is not able to get converted into glycogen because insulin deficiency is there. So more and more glucose, right? Yeah, the mother will be hyperglycemic. So maternal, एक तो ये बात तो यहाँ खत्म हो गई. One topic is finished here, that why the mother will be hyperglycemic, because there is insulin का deficiency. Insulin causes glucose conversion into glycogen. Insulin deficiency, so glucose is not able to get converted into glycogen. So more and more glucose. So there is maternal hyperglycemia, right? So whenever there is maternal hyperglycemia, there will be fetal hyperglycemia. Yes or no? Whatever that mother blood is having through the placenta and the umbilical cord, it will reach to the baby. So the if the in the mother's blood is maternal hyperglycemia, that will lead to fetal hyperglycemia. Yes or no? जो मम्मी खाना खाएगी वही खाना बच्चे को जाएगा ना. मम्मी अच्छा खाना खाएगी तो अच्छा खाना बच्चे को जाएगा. मम्मी बुरा खाना खाएगी तो बच्चे को बुरा खाना जाएगा, राइट? Whenever there is maternal hyperglycemia, there will be fetal hyperglycemia. Now imagine fetal hyperglycemia came, okay? So what is happening in the insulin levels in the fetus normally? So newborn is not suffering with diabetes, right? Mother was suffering with diabetes, and mother was having insulin ka deficiency. But is baby having insulin deficiency? No, right? Baby is not having insulin deficiency. Baby insulin level is normal. Baby insulin level is normal. So when too much of hyperglycemia means too much of sugar is there. What does insulin does? Insulin converts glucose into glycogen. Yes or no? When insulin working properly, when so the more and more fetal hyperglycemia is there, though that glucose will get converted, the whole glucose will get converted into glycogen, and the baby will land up into hypoglycemia because the insulin is working fine in the baby. That is why whatever that hyperglycemia was, everything can got converted into glycogen, leading to hypoglycemia in the baby. And in the mother, insulin is not working properly. That is why glucose is not able to get converted into glycogen. So mother came into hyperglycemic picture, and the baby came into hypoglycemic picture. This is known as modified Pedersen's hypothesis. This is known as modified Pedersen's hypothesis. Has everyone understood this much? Yes or yes, yes. You can give a golden heart or a black heart or a blue heart. What do you think? Hmm. Okay, हम्म, ठीक है तो मैं डन ठीक है that's it. That finishes today's class. That finishes today's class. अब अपने अपने घर जाओ. Go to everyone, go to your houses. Enough of today. And yeah, गुलाबी तिल. That finishes today's class. Thank you so much everyone for this wonderful participation. So tonight we have a class at 8:30 p.m. on our Unacademy channel. If you are a newcomer, please download Unacademy and go search Pediatrics Anand Bhatia, or just search Anand Bhatia. Follow me there. Tonight we have a class at 8:30 p.m. for the FMG rapid revision rounds. Last moment FMG revisions we have. And tonight 11:15 p.m. Tonight 11:15 p.m. I'm having this OP Ghai sessions. I hope you all guys are a part of it. From chapter number 1 to last page number 783, I'm doing the rapid revisions of OP Ghai chapter wise, page wise. First, we have the audio sessions in our group. Then every third day, I'm taking test in the Unacademy, our special class. So 11:15 we have a OP Ghai class. And today 8:30 p.m. we have a very importantly last moment FMG one liners and last moment FMG important images. So I hope you guys are a part of it. Okay. So Chakravarti says, will that be class useful for NEET PG? Yes, dear, definitely. There's no doubt about it. It will be helpful, Chakravarti. You yourself will say, okay, sir, these questions are very important. So you come. Okay. Don't worry. Just come. Okay, Ghana. Ghana. Okay. मुझे याद नहीं आ रहा. मुझे याद नहीं आ रहा. Okay, so तो सुनाऊं को मुझे याद नहीं आ रहा. याद नहीं आ रहा. अच्छा ठीक है. कोई भी सुनाता हूँ. ठीक है, कोई भी सुनाता हूँ मैं. कुछ ना. ठीक है, चलो ठीक है. लेट्स हैव अ सॉन्ग. ओल्ड सॉन्ग है एज यूजुअल. ओके. यादों में तेरी खोया, रातों को मैं ना सोया, हालत ये मेरे मन की जाने ना जाने कोई, प्यार में तेरे दिल का मेरे कुछ भी हो अंजाम, दिल धड़कता है बार बार क्या कीजिए, आ गया जो किसी पे प्यार क्या कीजिए, आ गया जो किसी पे प्यार. दिल तो है दिल, दिल का एतबार क्या कीजिए, आ गया जो किसी पे प्यार, आ गया जो किसी पे प्यार। हाँ, ये थी आज शाम की आखिरी फरमाइश। ये गाने की फरमाइश की है टिंकू, बबली, रिक्कू और रजनी ने, भाई और बहनों। थैंक यू सो मच एवरीवन एंड लव यू ऑल। एंड ओसामा, ठीक है। अच्छा ओसामा, मैं अगली बार सुनाऊंगा। दिल चीज़ क्या है, मैं अगली बार सुनाता हूँ, बोला। तो मुझे लिस्ट बनानी पड़ेगी यार, ठीक है। थैंक यू ओसामा। मैं सुनाऊंगा अगली बार जो तू बोलेगा, ठीक है। 8:30 p.m. See you tonight at Unacademy platform with the amazing FMG questions. And this week I'm coming with top 50s triads in pediatrics part 1, top 50s one-liners, top 50 spotters, top 50 MBBS final year instruments which are important. So see you around. ठीक है। बाय बाय, टेक केयर, बाय शिवम, बाय एवरीवन, बाय जूली, ओसामा, बाय। ठीक है, आ जाना 8:30 टाइम लगे।